Local Health Department contract training, policy and procedure for submitting contracts to DPH. Saving contracts. Contracts shall be saved to the appropriate folder on the L drive for the fiscal year pertinent to the contract. File names for contracts shall begin with the following nomenclature: the fiscal year to which the contract pertains, your health department's 3-digit HID, and then the contract or provider number of the contract. For example, if the contract were for fiscal year 2019, the nomenclature would be 19101201101, where 111 is the health department HID and 20101 is the contract or provider number. Proper usage of this nomenclature assists Department for Public Health staff in the contract review process. Using the Excel spreadsheet in the appropriate fiscal year folder in your local health department's folder within LHD contracts, properly populate information or update information pre-populated by local health operations branch. For CH51 and CH53M contracts, be sure to check all programs that will need to review the contract in the appropriate column. Please do so by marking with an X. For CH53M contracts, be sure to indicate third-party billing and presence of CH55 if necessary. Once all of your coming fiscal year contracts are loaded to the appropriate folder on the L drive, send an email to lhdcontracts.programreview@ky.gov with the subject line, your health department's name, fiscal year with the appropriate fiscal year, contracts. State that contracts are available for review. Department for Public Health review staff will determine to review or not, and will advise health department contract staff of the determination, either accepted, rejected, or not reviewed. Department for Public Health staff will reply to the health department, appending the subject line of the email to your health department name, fiscal year, pertinent fiscal year, contracts, and then the program that is sending the information. And we'll copy localhealth.helpdesk@ky.gov in order to keep local health operations branch informed of the actions. If revisions to any contracts are required, the health department will reply to individual DPH staff, copying local health operations branch once revision is loaded to L drive for review. Local health operations branch will update spreadsheet data based on email communication between DPH and health department staff. Copy LHO branch on all email to provide accurate tracking. Save email from DPH staff for your audit purposes. The review status column of the spreadsheet replaces the information sheet as a record of review process. Contract file names on the L drive will be appended with review results. Submission date of your contracts. Kentucky Department for Public Health, Division of Administration and Financial Management requests that all contracts for the coming fiscal year be submitted for review no later than May the 15th. Unsigned school contracts should be submitted no later than April 30th. Local health departments that meet the May 15th submission deadline can reasonably expect to have review determinations completed prior to the start of the new fiscal year. Tracking spreadsheet usage. Using the Excel spreadsheet, your health department name, FY pertinent fiscal year, contracts, in the contracts folder for the pertinent year for your health department on the L drive. You should list all contracts by template. You will find a tab for each template in the spreadsheet. Where appropriate, for CH51 and CH53M contracts, as well as for CH52 school contracts, place an X to indicate any program or programs that have services covered by the contract. On the CH53M tab, indicate the third-party billing flag on the contract, whether third-party billing is the responsibility of the provider, yes or no, and the presence of a CH55 if applicable. Save the completed spreadsheet with your contracts in the appropriate folder on the L drive. To enter data into the spreadsheet, select the appropriate tab or sheet for the contract template. Use the first empty row when entering data. If you've deleted provider data and have a clean row, use it first. If the table is full, start a new row directly under the last row of data. The amount column is strictly optional information. The review status column is for LHO usage only. Use an X unless otherwise indicated. Use an X in fields to indicate programs covered in the contract on the CH51, CH53M tabs. On the spreadsheet, the CH51 and CH53M tabs require an X in at least one program cell in order to clear the highlighting from the template. Do not change the file name of the spreadsheet on the L drive. When working from the document on the L drive, be sure to save your changes. When working from a copy of your spreadsheet that you have perchance saved as a workbook on your local computer, when you upload back to the L drive, save as and replace the file on the L drive as you update, making sure to make use of the exact same file name as what is on the L drive. Provider or contract numbers. Contract provider numbers are assigned by local health operations. Contact local health operations branch by email for new provider numbers or to update a provider name. Please include contract template being used, brief detail of contractor duties, and the contractor name in your email. If you are requesting for a lab provider, please indicate if pathology services are included in the contract. Provider and contract numbers are assigned by local health operations branch only, with the exception of CH52 contracts, which have no requirement for a number. But at the local level, you may choose to assign a number for your own record-keeping purposes. In order to submit contracts for the current fiscal year, this would be for contracts that you enter into with a provider once the fiscal year has begun and will run until the end of the current fiscal year. Contracts that pertain to the current fiscal year shall be added to the appropriate tracking spreadsheet and saved to the current fiscal year folder on the L drive. Local health department staff shall send an email to pertinent DPH program staff. Local health operations branch shall be copied on that email. So if in November it is determined that you needed to enter into a new contract for provision of prenatal services, then you would, once that contract was saved to the L drive and the information entered onto the spreadsheet for the provider and the service to be provided, you would send an email to the individual responsible for reviewing prenatal contracts, and you would copy local health operations branch on that email. If you have any questions or concerns related to the submission and review process, usage of the spreadsheet, or provision of contract or provider numbers, please contact Local Health Operations Branch at 502-564-6663, option 1, or localhealth.helpdesk@ky.gov.